This is Grace Lynn Keller with the Becker's Healthcare Podcast, and we are live at the CEO and CFO Roundtable. I'm joined right now by Ashwani Bhatia, who is the Chief Executive Officer at Baker Clinic. So, Ashwani, thanks for joining me today. I would love to have you introduce yourself and talk a little bit more about your role as we get started.
Thank you, Heidi. Thanks for having me today. My name is Ashwani Bhatia. I'm the CEO and Chief Medical Officer of Baker Clinic, a physician-owned healthcare organization with a controlling interest in a level 2 trauma center in Green Bay, Wisconsin, overseeing about 250 clinicians and 1,000 employees serving over 16 communities. I'm a physician in training. I'm a physician by training, and I have had leadership positions throughout my career in physician relations, clinical operations, quality, clinical informatics, and medical education. I worked for Aurora Healthcare for over 12 years in various positions and joined Baker Clinic in 2019, starting as their Chief Medical Officer. And since 2022, I have been their CEO.
Wonderful. Well, thank you for taking the time to be here. And as we kind of close out 2024 and move into 2025, I'd love to know what your growth strategy is in the coming year or two.
Absolutely. Our growth strategy in Baker Clinic has always been about expansion. We still consider ourselves as a 25-year-old startup, but I think the next 1 or 2 years will be focusing on enhancing patient care and operational efficiency by expanding our services in the communities where the subspecialty care is lacking. We want to provide care to our patients in their community, and we continue to strengthen our outreach presence through our strategic partnership with Advocate Health. We are absolutely positive about ensuring that we continue to provide comprehensive range of specialized care to more and more communities in the next few years. Our strategic growth strategy is, for example, is specifically around orthopedics, oral and max, and ophthalmology, where we think is the most need in the surrounding communities in northeastern Wisconsin.
Wonderful. And as we kind of move into our next topic here, I'd love to discuss what you're working on right now. So what is something that's really exciting or a very impactful initiative or project that you have your hands in right now?
As I'm going through this conference, a lot of leaders are talking about culture, accountability in their organization. And one of the exciting things for me as a leader has always been having a strategic vision. And being in my 3rd year as a CEO, we have embarked on developing a roadmap and a strategic growth plan for Baker Clinic. Within the plan, there are key components which include growing strategically our outpatient surgical services, bringing additional subspecialty services that I already mentioned, but also reinforcing our commitment to a culture which is focused on accountability and adoption of regenerative AI in a way that our staff at the lowest level can understand how it will impact their day-to-day life. Again, adoption of technology is going to be one of our exciting projects. Already we are working on that. For example, we are enhancing our digital infrastructure so that the patients can more easily access their health information, especially through our app, and interact with our care teams directly. That is empowering them to play a more active role in their own healthcare journey. We want to communicate with our patients in a way that it's a two-way conversation, and they can tell us how they really want their care, and that will lead to a more customized care. I think that's very exciting for us.
And what is the most important thing you think healthcare executives should do to make sure their organizations are successful in the future?
Well, nobody likes to take any advice, but if I have to give any advice to all the healthcare executives today, I think their focus on succession planning and listening to their staff is going to be the most important thing. They need to focus on creating resilient, adaptable culture that fosters both accountability and innovation, and which helps them in succession planning. And we know that in the face of rapid technological advancements, changing care models, workforce challenges, it is essential to empower teams to think proactively and embrace a change which is considered to be a shared responsibility. I think for that, as we are living in the world of artificial intelligence, and we will continue to do so, I think hiring emotionally intelligent people will be the key to their success. I think leaders continue to invest in their well-being of their staff, development of their teams, ensuring they have the tools and support that they need to thrive will be very essential for the success of the whole organization.
Well, thank you so much for taking the time to join us today on the Becker's Healthcare Podcast. Again, we are live at the CEO and CFO Roundtable.
Thank you.